your benefits will not be reduced by a nickel.
They're going down a lot more than a nickel. These cuts, these lapses of enhanced tax credits, these are not things that are going to save money to taxpayers. These are just all going to pay for tax cuts for the very wealthy. So for folks going, well, yeah, we need to cut government spending. We're not really cutting government spending here.
Republicans shut down the government instead of lowering healthcare costs. As you said, without action, millions are going to see their premiums rise by an average of 75%. And so rather than fixing the problem, Republicans in Congress like Brian Stile and Derek Van Orden are just sitting on their hands.
The government shutdown and how long this is going to last. And in doing so, keeping in mind the root cause of this. And we've got a president who's coming up with all manner of distractions. For example, a lot of the halts to federal spending are not being done across the board. They're being done in an overtly partisan political way, shutting down projects in so-called blue states rather than red states, kind of stuff that is, unethical as you can imagine. And we may get back into that tomorrow morning, but I say that to say again, to keep your eye on the ball. And what is this all about? And this is about cuts to healthcare and the increase number of people in Wisconsin and across the country that are learning about it. And they're learning about it because of groups like Opportunity Wisconsin. And Meghan Rowe is going to join us now to tell us a bit more about what the group is doing. Meghan, good morning. How are you?
Good morning. It's Monday, so we're hanging in there.
Yes, we are, with, just day after day. And I watch the updates that you're putting on social media and some of the events that are taking place. And I mean, do you feel like characterized it fairly in talking about the increasing number of people in Wisconsin who are kind of getting past the talking points and understanding what this shutdown is really all about?
Oh, yeah, absolutely. We've been working since early 2020 to really highlight the impacts of economic policies at the federal level on Wisconsin workers and families. And I think this moment in time, more than ever since the beginning of our program, we're really seeing it sink in for people. We held candlelight vigils last week before the shutdown took place in La Crosse, Eau Claire, and in Southeast Wisconsin. And it was a last minute event. We put it together and we had such amazing turnout because people were really concerned and are starting to really understand how this shutdown is going to impact their lives.
We had Selena Heller on, one of our reporters at Up North News, and we ran a story that folks can see over on the Up North News social media sites. A woman from La Crosse getting very emotional, tearing up at the prospect of not being able to afford health insurance. She and her husband are just a little too young yet for Medicare, but they're also at a point where they don't have jobs that offer, health insurance. And so the exchanges on the Affordable Care Act made health insurance affordable. And it's starting to hit them just how crazy expensive health insurance is going to become, as the open enrollment period approaches next month. And I feel like what Selena did there was capture in just this one person what I think we're either seeing now or soon will be seen in households all around the state and frankly all around the country as well.
Yeah, I mean, that's the bottom line when it comes to this shutdown. Republicans shut down the government instead of lowering healthcare costs. They refuse to address massive healthcare cost increases and extend tax credits permanently that help millions afford care. And so, as you said, without action, millions are going to see their premiums rise by an average of 75%. And so rather than fixing the problem, Republicans in Congress like Brian Stile and Derek Van Orden are just sitting on their hands as we speak today.
And the thing is, I mean, and I've seen this in your social media posts and emails, that these are two among many members of Congress who said, we will not vote for something that makes massive cuts to healthcare. And yet here we're seeing the massive cuts to healthcare coming. And what we always hear, Meghan, is that, the cuts are actually to make sure that people who qualify for Medicaid or Affordable Care Act subsidies actually get them. But I mean, that's not the point. The point actually appears to be adding all kinds of red tape or expense to people who do get it. When you're cutting $1 trillion from Medicaid over time here, it's pretty clear that $1 trillion in Medicaid wasn't going to undocumented immigrants.
Oh, absolutely. And to your point, earlier this year, Opportunity Wisconsin flew out to Washington, D.C. with a handful of folks from across the state to help them share their personal stories with their members of Congress. And we actually sat down with Congressman Van Orden for upwards of 2.5 hours. And in that meeting, he made promises to his constituents in that room that he was not going to cut or touch their benefits. And shortly after that meeting, both he and Congressman Stile passed that tax law that ripped healthcare away from over 100,000 Wisconsinites and made drastic cuts to SNAP. And again, this is all to pay for tax breaks for the wealthy. And now, as we sit here today, they're blocking plans to reverse that damage and to lower healthcare costs additionally.
Can I ask you, that when you sat down with Congressman Van Orden, and I just want to know if you heard this much, I recall seeing that, and I thought, and I'm sure other people are thinking too, it's like, why are you letting this congressman, first off, it was, I guess, good for him and the others that they sat with you, knowing your positions on the issues and things. I thought, well, you're giving him oxygen to say, what we assume is falsely, I'm not going to make any such cuts. But of course, in hindsight, you see the wisdom of that. You've actually got him on the record with you, promising not to make these cuts.
Yeah, absolutely. We certainly were skeptical that he would even take a meeting with us, and we're glad to see that he was at least willing to sit down in that conversation with his constituents. And like I said, he made the promises that he would not cut those benefits. He essentially lied in that conversation, went forward to make those cuts. And since then, I'd, like I said, love to give him the benefit of the doubt that he sat down with us. But after he made those cuts, if you'll recall, he has refused to hold any in-person town halls or conversations open to his constituents. And so it's very clear that both he and Congressman Stile know exactly the impact of these votes that they have taken, and they're afraid to adjust their constituents.
Right. We're talking to Meghan Rowe from Opportunity Wisconsin about keeping an eye on the ball when it comes to the healthcare cuts that are being made here. So now I have to, as I often do, say it, in fairness about the enhanced tax benefits for the Affordable Care Act. These are credits that were due to expire. And so there are definitely cuts coming to Medicaid programs. This one is more of something that was due to expire. The point being, though, Meghan, is that, again, Democrats have been saying, if you want our votes to help pass a new federal budget, part of it is extending these tax credits. So, I mean, people, I believe, Meghan, are aware or need to be aware that in some cases we're talking about actual cuts. In other cases, we're talking about benefits that were set to expire, but they're really good and they work. And why wouldn't you continue them?
Yeah, absolutely. I think especially you hear stories from small businesses that have benefited greatly from this additional support in their healthcare costs. And, small businesses are already struggling across this country because of rising costs, because of Trump's tariffs that Congressman Stile and Congressman Van Orden also support. And so this doesn't have to happen. Republicans chose the shutdown because they wanted working families and small businesses to pay more for healthcare. And so they need to be putting these working families first, reverse the harmful Medicaid cuts that they made earlier this year, prevent healthcare costs from rising, and keep the government open.
I've been asked by Tony on YouTube here whether the meeting with Van Orden was that something that was recorded and published, or is that something that you took part in and reported on afterwards?
Yeah, it's something we took part in and reported on afterward. And there was a group of about 6 or 7 constituents in that meeting, and they all had the opportunity to go around and share their story, which was great and is really at the core of what we do at Opportunity Wisconsin, is uplifting individual stories and help them get across to their elected officials. But unfortunately, it seems like it fell on deaf ears.
Yeah, and by the way, there's ample recorded interactions with Congressman Van Orden, for example. He was famous for saying that benefits for people who deserve them won't go down a nickel. A nickel. He repeated it. We've repeated his words back several times that he said they wouldn't go down a nickel. They're going down a lot more than a nickel, as we go forward here. So we've now established these types of cuts, these things that could be restored to make healthcare more affordable. Um, Before we go looking forward, I always feel like it's necessary to again say that these cuts, these lapses of enhanced tax credits, these are not things that are going to save money to taxpayers. These are just all going to pay for tax cuts for the very wealthy. So for folks going, well, yeah, we need to cut government spending. We're not really cutting government spending here, are we?
No, absolutely not. And frankly, the shutdown that we're currently in is going to be forcing millions to go without paychecks. We're on day 6, so pretty soon folks are not going to be receiving their paychecks. It could be delaying Social Security and veterans benefits. And one thing that I think is starting to gain more traction that I don't think a lot of folks are talking about is how it is going to be cutting off nutrition assistance for pregnant women and young children through WIC. That program is set to run out of money at some point this week. And on top of the SNAP benefits that were cut earlier this year, you can imagine that is going to be very devastating for a lot of people in Wisconsin.
So let's look forward then in our last couple of minutes here, and either things that you're doing or things that you think people can do if they want to, either learn more about the issue or have some kind of input on, their concerns about the current shutdown.
Yeah, absolutely. So, as you said, we're squarely focused on the shutdown right now and making sure people are educated and understand that this is an issue that can be solved if Republicans like Congressman Van Orden and Congressman Style would stop sitting on their hands and decide to put working families in Wisconsin first. And so, folks can visit us at opportunitywisconsin.org, where they can share their story about how this shutdown is impacting them. They can follow us on social media, share their story there, and stay in touch because we're hosting events all throughout this month. And as long as it takes to make sure our elected representatives know how this is impacting their constituents. We're also talking about Trump's tariffs that are really, as I said, having a huge impact on small businesses and families. Wisconsin families are already struggling to make ends meet. And with the rising cost of groceries, back to school items, as we get into the holiday season, we already know that gifts for loved ones are going to be much more expensive this year. And so we want folks to stay involved and stay engaged because raising your voice is really one of the most important ways we can make change at the policy level.
I'm glad you brought that up because we've had all this focus on healthcare, but we also have, the trade war that the president started and the impact that we're continuing to, feel on the store shelves and what we're going to see, come the holiday season. So I'm glad you're able to keep the eye on more than one ball at a time. We always feel so overwhelmed, but we've got groups like Opportunity Wisconsin that are able to do that. Meghan Rowe is the program director. And again, opportunitywisconsin.org is the place to go to learn more. Thank you, Meghan, very much for visiting with us and giving us some background.
Thanks for having me.
Yeah, our pleasure. Thank you again. Have a wonderful day.